Here are the best 5 antidepressants, both in terms of most effective and most well tolerated. I'm Dr. A GP based in the UK. There was a very large meta-analysis done in 2018 of over 100,000 patients, and it compared 21 of the most commonly used antidepressants. And here are the top 5. So the first one is sertraline, which is an SSRI. It's probably the most commonly prescribed one, and I prescribe it very often for patients. Number 2 is another SSRI, paroxetine, again very commonly used. Number 3 did surprise me a bit, but it was mirtazapine. But this is very useful in specific situations. I actually done a whole video on mirtazapine. Check it out, it's on my profile. But it's very useful in patients who are losing weight or who can't sleep. But I found it causes grogginess. But the next medication can be very useful and doesn't cause grogginess. Okay, so number 4 is a medication you may not have heard of. It's used far less often, and it's called agomelatine. Now, this medication is a melatonin receptor agonist, and it's fantastic because it helps with sleep, as well as obviously depression. But the great thing about this, it causes far less grogginess throughout the day than mirtazapine does. Okay, so finally, number 5 is my personal favourite, and it's escitalopram. I found this to be fantastic, not only in terms of effectiveness, but also side effects. The patients I've used it for have reported fantastic results and have been on it with no problems most of the time. So if you're on another antidepressant, don't panic. In reality, the choice of antidepressant is specific for a patient and depends on various factors. So if you're on one and want to change to a different one, please make sure you consult with your doctor, because most of the time you need to taper off one before you start the other.